Hey there, it's Christopher Westfall. Today, something major happened in the world of health insurance, Medicare Advantage specifically, about prior authorization. Everything is completely fixed now, or is it? Here's the details that others won't tell you. First of all over the news today and every news outlet out there possible, they're talking about RFK Jr. and Dr. Oz announcing changes to prior authorization for health insurance. What does that mean? According to a press release by the industry spokesperson known as AHIP, they're going to standardize the electronic prior authorization process. It's not going to be faxes sent in on one company and a phone call on another, an electronic prior authorization with a different company. All of that is going to be finally standardized by 2027. And then they're going to reduce the scope, and this is something Dr. Oz talked about in his Senate confirmation hearing, of which procedures actually need prior authorization. He thinks they can bring it down to about 500 instead of how many thousands they are. That would be great. However, that's also voluntary and might start happening in January of 2026. Then the continuity of care. This one is great if it can really happen. Let's say you're with one Medicare Advantage company and you go through all the steps to get prior authorized for a system of treatment. That could be chemotherapy, it could be some expensive drug, and then finally you get that, only now it's the fourth quarter of the year and you're going to change possibly to a different Medicare Advantage plan come the next year. What do? Well, according to a voluntary participation from these insurance companies, I'll share with you which insurance companies are involved here in just a minute, but they're going to honor a 90-day transition period through that first quarter when you have to get to the different insurance company. Then they're supposed to provide easier, understandable explanations of the determination, which will explain to you if they're missing some documentation, what you need to do to get it to the insurance company to make it finally okay. And this again is voluntary. They say they're going to expand real-time responses by 2027. That's 2 years from now. And in 2027, they expect that 80% of prior authorization approvals will come right away. Again, that's 2 years down the road, and this is voluntary. It's not a code in CMS, and it's not a law by Congress. And then participating health plans, and I'll share with you which ones are participating, affirm that all non-approved requests based on clinical reasons will continue to be reviewed by medical professionals if they're denied. So they're saying rather than an AI program saying you're just declined, it'll actually go to a medical professional. Will this happen? We'll see. Oh boy, we just jumped ahead. If you want to see if your Medicare Advantage company is participating or not, you can hold up your phone and you can click this. This is an updated list. This list provided by AHIP to see if your insurance company is going to participate. And also you can find it in the description below. But I want to show you what Dr. Oz had to say today about this new program. And again, remember, it's voluntary.
Access for patients. This is a critical issue because imagine you're in a doctor's office and you've got a bad diagnosis and there's a procedure or a test or a treatment that you think is right for you, and you find out that you can't start that treatment for sometimes weeks, even longer. It's more frustrating than anything else in the process because at least that's something you do control. You don't control much else when you're in a physician's office with that kind of a crisis, and yet it's withheld. And these approvals with this new pledge will be streamlined. It will happen very quickly. Necessary care will be delivered when it's needed in the right way. So you get both quality and you get timing, which goes along with that quality.
Did you pick up on the fact that this is a pledge? This is a pledge from the insurance companies. They know this is a real problem, and they know that Congress was coming after them based on the new administration saying they're going to crack down. Remember, Dr. Oz said there's a new sheriff in town. Here's what Secretary Kennedy said.
85% of Americans say that they have had delays in healthcare because of prior authorization. And the doctors hate it. Doctors report that it costs them 12 to 15 hours a week filling out forms. Some nurses are spending over half their time dealing with the administrative burden of this.
Just remember, when you're on Medicare or you're approaching the age of 65 and you have a Medicare choice to make, Please listen to this message that you won't hear from most of your insurance agents. There is Medicare Advantage that has this crap called prior authorization, and it's totally optional. They decide what you get for healthcare. They decide when you start treatment, what documentation is necessary before they'll approve you to start treatment, and what limited treatment you're going to get. Because remember, their profit is tied to how much dollars they get from the government minus how much they have to pay for your care. But there's a different choice. If you go to original Medicare that you've paid into for your whole life, you get a choice of going to a Medicare supplement, which pays the other 20% that original Medicare does not cover. And guess what you get? Access to all the doctors and hospitals in the country with no network restrictions whatsoever, as long as they accept original Medicare, which is just about everybody. There are no networks, there are no prior authorizations, there are no restrictions like the ones we're talking about. So all the people, 85% of the people that are out there have encountered prior authorization problems that doctors hate, hospitals hate, and patients hate. It's optional. If you're not on Medicare Advantage, you're not going to have that. Here are two members of Congress that also happen to be doctors. Listen to what they have to say about prior authorization and Medicare
Like
Advantage.
Dr. Marshall, I have had innumerable episodes where patients call back crying or patients call back upset that their insurance company would not allow things, would not allow a treatment plan that I, as their trusted physician, have recommended.
Here's another one.
We must prioritize patients' health over corporate profits and arbitrary cost-cutting measures. For nearly my entire time in Congress, I fought to reform the prior authorization process in Medicare Advantage.
Oh, in Medicare Advantage. I'm going to share with you in just a second how your Medicare Advantage company, or one you may be considering, has been doing with prior authorization. How many times are they denying claims? How many times are they approving things? I'll have that data for you in just a second.
Today's event moves us closer to that goal, ensuring patients receive timely, life-saving, and health-restoring care. Again, I just look forward to working with Secretary Kennedy, Administrator Oz, and insurers together to overhaul this process. I'm going to continue to champion this fight in Congress and support their efforts. And again, I'm just proud to stand alongside President Trump's A-team as we work to make healthcare more patient and...
Listen, I'm all about it. As you can tell from my last video with Secretary Kennedy, when I had my interaction with him here in Charleston, he said he was going to look into this and he was going to try to enforce his own agency's Office of Inspector General recommendations to rein in Medicare Advantage. It looks like they're doing that. But again, this right here on prior authorization is a pledge. So how have the companies been doing on prior authorization? We can see that Centene denied the most, 13.6% of the time, they're denying these claims. And then 8% of the people appealed. Why don't you appeal? If you're getting your claim denied, absolutely appeal, because more than 88% of the time it's going to be approved. And in Centene's case, disapproving the most, 94% of the time, that thing's going to be overturned on appeal. So why wouldn't you do that? Why wouldn't you appeal it? And then CVS, Aetna, not much better. Kaiser, which is the nonprofit, still denying 10% of the claims. United Healthcare, 9.1, Cigna, 7.7, and then the overall average there, 6.4%. So who's better than the average? Blue Cross Blue Shield, Anthem, Elevance, and then Humana, which looks to be my darling favorite here, because look at this. When Humana does deny the claim on Medicare Advantage, when people do appeal, 64% of the time, the people are successful. Well, what does that mean? It means that maybe the reason for the denial was more accurate than the other companies, all of them together. So if you have somebody that's up there 93% of the time, their appeals are being overturned, it means they were wrong to deny that claim in the first place. They shouldn't have done it. And when you're looking down at the best one down there at Humana, 65% of the time, yes, it's overturned, but that means the majority of the time, not the majority, but more than the other ones, when they denied, and it was the least 3.5% of the claims denied, that means that's where I would put my bet to go with. And yeah, there are some other smaller companies in there that they have under others. Some other small companies that we love are not even in this list because they just don't have enough covered lives yet. Pretty interesting data there. So something else has just been announced with Medicare Advantage. And for the greedy insurance agent that, like I just said, never shares with you that there's another alternative besides Medicare Advantage. Yes, these agents just got a raise. What? They're going to make more money? Let me show you the difference. And this is why insurance agents hate me. Yep, this was announced just now. Medicare Advantage commissions for 2026. When we sign you up for a Medicare Advantage program, and by the way, our office does both Medicare, Medicare Supplement, and Medicare Advantage. We want to listen to find out what may be the best thing for you based on how often you go to the doctor, what complicated conditions do you have, what chronic conditions do you have, how important is it that you must see a particular doctor or hospital, how often do you travel. These are things that your agent must ask before making this recommendation. But let's go to the chart. So the first year on Medicare Advantage, the national commission, the maximum that an agent can make is $694. Most agents pay this national average, or this maximum. However, if you live in Connecticut, Pennsylvania, or DC, they make a lot more. If you live in California or New Jersey, look how much they make the first year putting you on a Medicare Advantage plan. Now, how does this compare when an agent has maybe the ethical, financial dilemma of deciding, should I put all my focus on Medicare Advantage only, which most agents do, and they don't even talk about Medicare Supplement as an option, or if they do, they're not educated enough on it, because if you look at their actual numbers, you'll see that 95% of what they write is only Medicare Advantage. They may give it lip service to tell you about Medicare Supplement, but they'll say things like, oh, that's too expensive, nobody buys that, which is a lie. So let's look at the commissions. Oh no, agents are going to be really mad now. If I'm showing you a Medicare Supplement Plan G, which I argue is not the best recommendation, but it's when an agent's telling you about Medicare Supplement, they're going to focus on Medicare Supplement Plan G. Why? Because it's super simple to explain. It pays everything. Doesn't that sound great? Yeah, until you look at the rate increases in year 2, 3, 4, 5. We covered recently on this channel, one company in one state's already gone up 40%. And for those of you on Plan G who have not experienced the double-digit rate increases, they're already filed and they're coming at your next renewal. But I digress. So let's say this agent is playing it cool. He's only talking about Medicare Supplement Plan G is the only place you should be. Even then, he's going to make, or she, they're going to make a whopping commission of an average premium in the country of, let's see, $144.17 for a person turning 65. So we want to compare apples to apples here. This is a person brand new to Medicare, and they're going to go on Plan G, an average premium of $144.17, an average of 22% commission. That's what the agents are making nowadays. That's going to give this agent in the first year $380 in commission. Now, it must be said, whether you go directly to an insurance company or you elicit the services of an independent broker, such as myself in my office, you pay the same premium. So when you cut out the agent, go direct to the insurance company, they just make more money from your business. They don't give you a discount for going direct to the insurance company. So you might as well use the services that are free of an independent broker. But what, instead of me writing you Plan G, which is very simple to explain, any doctor, any hospital, no networks whatsoever, no prior authorization, no referrals required, go anywhere you want to in the country that accepts Medicare, which is most everybody. Good plan, except I'm going to make less than half the commission because next year, this is using data from New Jersey and California, those high first-year Medicare Advantage commissions I showed you, you're going to make that much more money, $864 in that first year. Now, if you're an independent business owner and you have a choice to make, am I going to make twice as much from half as many people to make a lot more money in my practice? Should I focus on Medicare Advantage? Well, remember, Medicare Advantage in most of these programs doesn't cost anything. So it means that all they have to do is merely get your John Hancock, your signature. And they can even do it just over the phone. And they can even do it just verbally. So if you get them permission, give them permission to sign you up on just a no premium Medicare Advantage plan, and it's your first time on Medicare and you happen to be in one of these states I'm specifically calling out right here, slow down, double the commission. But let's say this is an agent who's going to take the time to listen to you. They're going to probably find out that when you're turning 65, based on your needs, of course, and everyone's different, they may find, like we do in the majority of cases, Plan N is a better deal for you. and we take the time to explain the difference and see if it fits you best. Well, let's see what happens if I put you on a Plan N. Look at this right in the middle. Let me make it larger so you can see. My commission on Plan N would be this. It may explain to you then why some agents don't even explain Plan N for you. If you had an agent that only told you Plan G is the best way to go, at least they told you that Medicare supplement was available. But Plan N, no, it doesn't make us as much money, but I'll tell you when it makes people happy is when they get their rate increase notice. Like in that particular case I talked about earlier, the insurance company in one state announced the first one, and then a wave of massive rate increases came after that. But when it was 40% for Plan G, that same state with the experience as bad as it's been in 2024, 25, 28% on Plan N. Yes, 28% is horrible, but compare that to 40. Now multiply that times 3 years and see if you could still afford the premium of Plan G. I made a website to show you what Plan N is in case no one showed you that before. And let me see if I can show it to you right here. It's called plannmedicare.org, plannmedicare.org. If you go there, it'll explain what this little known thing is called Plan N that doesn't pay your agent as much commission, but it may explain why you too have never heard of it. And yes, we can help with Medicare supplement changes all year long. You don't have to wait for one time of the year to change your Medicare supplement. You can change any time of the year you want to. But again, just keep in the back of your mind what the commissions are being made by somebody putting you on a Medicare Advantage plan for the first time if you're new to Medicare. If any of this information has been remotely helpful for you, if you've learned anything from this channel or hope to in the future, please subscribe to the channel. I don't want you to miss any updates on Medicare. We're here just to help people with free advice, free information. If you didn't see my video of the confrontation, I don't think it's a confrontation really, because he took something away. He said he would look into it, and then enacted all these changes like hiring 20,000 auditors to go after Medicare Advantage and make sure they're not screwing over seniors and the taxpayer every single year. It's been a long time needed, and he's actually doing that, I think, in part due to this conversation that I had with him. If we can help you in any way, shape, or form, look at your options. I went from law enforcement to insurance, which is a really weird career switch, but still it's helping people. And in this day and age, people need somebody they can trust. They need to figure out what is the best thing for them. And even if you're with a great program and you love your insurance agent, why don't you give us a chance to be your second opinion? That's all we're asking, for an opportunity to look at what you have and possibly propose to you something better. And again, our service costs you absolutely nothing. I'm Christopher Westphal. Thank you for watching. God bless you, and we'll talk to you next time. Bye.